So Connections California is one of PHP's newest programs. It was created to help families navigate the overwhelm and excitement that is transition to adulthood. We've created a statewide hub of resources and information in English, Spanish, and Vietnamese to assist our families with young adults with any disability as they transition to adulthood. Connections California contains live events, curated videos through our e-learning library on all topics related to transition to adulthood and adult services. So we're very grateful for the generous support of Santa Clara Family Health Plan for making all of this possible. We're going to be putting the links in the chat to our Connections California pages and also to the spring program guide so that you can see our remaining spring offerings. Now I would like to introduce our esteemed speaker of this evening, Jim Huyck. Thank you for being here. Jim has assisted over 700 families and their loved ones with disabilities as they navigate through various public benefits, including SSI, SSDI, Medi-Cal, Medicare, regional centers, and IHSS. Before becoming a public consultant, Jim served as executive director of Alta, California Regional Center in Sacramento, rehabilitation counselor with the California State Department of Rehabilitation, and associate dean of special education for the San Diego Community College District. Now we would like Jim to take the floor. So I'm going to be stopping my share and we're going to allow you to go on, Jim.
Louisa, thank you very much. Let me pull up my screen. Okay, can you see it okay? Okay, thank you very much for the introduction and the opportunity to present today. What we are going to be talking about is IHSS, In-Home Support Services. Okay, it's not letting me advance my screen.
Let's see.
I'm stuck on the first slide.
Okay, do you want me to do it for you?
Sure.
Okay, if you want to stop, or you can stop the screen and you can try it one more time. If not, I'll do it on my side.
Yeah, let's try again. So share
Okay.
screen. I pull up the program. Share it. Okay, hang on. This may do it. Slideshow from the beginning. Okay, now it's working.
Great, thanks.
Okay, thank you. Okay, so in-home support services, IHSS. I think some of you may be familiar with this, and I know you're going to have questions about this and how it relates to some of the services that Regional Center provides. But basically, in-home support services, it's for both children and adults with disabilities who are unable to perform activities of daily living and cannot remain safely in their homes without help. So basically what this is, it is a Medi-Cal program. And so what Medi-Cal is doing is they're saying if we can provide the support an individual needs in their home, then they can remain with their family. They can be provided the supports they need to be in their home, and they would not have to be in a facility. And it always comes down to dollars and cents. And so for Medi-Cal, this is a great deal because they can pay less money, they can keep families together, and they can provide the service to individuals. But because of that, the individual must be on Medi-Cal. And also they cannot be in a assisted living. They cannot be in a board and care home because assisted living and board and care provide those supports to the individual. So the person must be in their own home, or as the regulations say, an abode of their own choosing. So that could be, when you say in their own home though, it can be the parent's home or it can be their own home, okay? They could be an apartment, they could be, but they can't be in assisted living or nursing care or board and care. And the process is a county social worker, an IHSS worker, comes out and does an assessment. Now during COVID, a lot of this was being done by video, but now I'm hearing more and more that the IHSS workers are coming out to the homes and actually doing the assessment. And what the IHSS social worker will do will assess the various types of services that individual needs and the number of hours and minutes that the county will authorize to provide the support to that individual in their home. Now, the maximum number of hours is 283. Most people don't get 283, but I can talk about in a moment how you can get 283 for some folks with disabilities. So IHSS, again, is an extremely important benefit to persons with disabilities. It's the primary statewide program designed to provide non-medical personal care and other in-home services, again, to allow the person with disabilities to remain in their own home. The person with a disability must be unable to perform the services for themselves or unable to remain safely in the home unless the services are provided. And again, this is an IHSS, I'm sorry, it is a Medi-Cal funded program. So what is the process? Process for each of the 58 counties, because in California, each of the 58 counties administers the IHSS program. And if you go to the IHSS website for each of the counties, it'll tell you how to apply. Many times it's a phone call, sometimes it's a form to be filled out and to submit. But the important thing is that the first step, besides applying, is that a healthcare certification form has to be filled out. It's government, so there's always forms to be filled out. And this particular form is filled out by the individual's doctor. And the individual's doctor is signing the form certifying that if this individual did not have IHSS support, that they would be in a facility, which is pretty strong language. And sometimes doctors are a little hesitant to sign such a form. And so we sometimes have to doctor shop a little bit, and we ask the client, the family, well, do you have another doctor that maybe would be willing to sign the form? Because some doctors just are a little hesitant to say that this person needs to be in a facility. But that's basically what the form says, because that's what this program is for individuals that would otherwise need to be in a facility. Although most of the folks I work with, I don't think they really would go into a facility. They don't need that level of care, but that's what the program requires. So there's an assessment that's done by the IHSS social worker. And it used to be that they would take each of the tasks, the support tasks, and we'll go into those in a minute, and they would say, okay, let's say the person needs to be toileted, or the person needs to be diapered or bathed. And the question would be, okay, how many times a day do you have to do that? How long does it take to do that? And they would calculate out minutes and hours. But that became very cumbersome. And also it was not equitable across the state because not all the social workers were applying it in the same way. So IHSS went to what they call the county guidelines. And these county guidelines do a numerical scoring according to the person's age, and then what their level of functioning is, and then how many hours they get per tasks. So it's much more cut and dried than it used to be. Although, as I many times have to point out to the IHSS social workers, these are just guidelines. So there can be exceptions made if you can make the argument that the person needs more assistance in a particular area than the guidelines allow. And then, of course, there's always notice of actions by any agency. And so if you disagree with the notice, with the number of hours and minutes that are authorized, you do have the right to appeal that. So what are the services? Domestic services such as sweeping, vacuuming, taking out the garbage, wheelchair cleaning, battery recharging, changing bed linens. There's a category of minutes and hours under a category called related services, meal preparation, cleanup, laundry, shopping. So for instance, with laundry, and the social worker will many times say that, they'll say, well, are you doing separate laundry for this individual? Or are you doing extra laundry because maybe they soil their clothes at night? Are you doing a separate meal, or is it the same meal that you prepare for the rest of the family? Well, some of our clients are on very special diets. They have to have special meals. And so there can be extra time given for that meal preparation and the cleanup of that. Then there's a category called personal care services, feeding, bathing, grooming, dressing, bowel and bladder, and help with medications. And it's good to understand that with IHSS, they only give minutes and hours for actual hands-on. They don't authorize minutes and hours for what's called standby or monitoring. So in other words, if Johnny's in the shower and the mom has to say, Johnny, be sure you wash your hair, you don't get any time for that. If mom has to open the shower door, put the shampoo on his head and massage and lather up his hair, you get time for that. So it's the same with bathing. If you have to literally put your hands on the person to bathe them, if you have to, for dressing, you can't just say, now be sure you wear your jacket, or I'm going to lay out the clothes that I think you should wear. You have to literally have to zip up the zippers and tie the shoelaces and Velcro the shoes or whatever. And so it does have to be hands-on. They do give you time for transportation to medical appointments or other types of services, like if there was therapies, they do authorize minutes and hours for transportation to those programs. Okay, there's another, so again, there's another category called paramedical services. And that's where the individual needs, it's not really medical, it's called paramedical. So it'd be such things as injections, breathing treatments, nebulizer, catheter changes, skin and wound care, suctioning, a bowel program, insertion of suppositories or administration of an enema. And again, we're government, so we're talking about government, so there's another form to fill out, and that would be the paramedical form that has to be filled out by a doctor, stating that these are services that need to be provided to this individual, and that the parent or whoever is the IHSS provider is qualified to provide these paramedical services to the individual. Now there's another category, which I always say is the top one, and it is what's called protective supervision. And this is a category that will allow you to get that maximum 283 hours that I mentioned was the maximum number that you can get. Now this is this is service for people who, due to a mental impairment or mental illness, need to be observed 24 hours per day to protect them from injuries, hazards, or accidents. So IHSS wants to know if this individual needs protective supervision, and it has to be based upon a mental impairment, as I said before, or mental illness, and that it causes functional limitations in memory, orientation, and judgment. So those are the three categories. And again, there's a form that has to be filled out, excuse me, by the individual's doctor, stating that, and there's a box to be checked, and it's mild, moderate, and severe. So I always recommend, if all possible, that the box for severe under the three categories of memory, orientation, and judgment be checked, because that's where you could get the 283 hours. But under each of those categories on the form, you have to give an anecdotal example of why or how that individual's memory difficulties in memory, orientation, and judgment has resulted in possibly they're getting out the front door, they're eloping, or they are getting into the knives in the kitchen or into the caustic materials under the sink. Now, doctors don't usually take the time to put those anecdotal entries on the form, and many times they don't know the specifics. So I always advise the families to fill out that part of the form, give it to the nurse, and let the nurse give it to the doctor, and hopefully they'll just sign off on it. Now, as to who can be the provider, the parents of a minor child can be the IHSS provider. Now, if a parent is working, first of all, we'll talk about a one-parent household. If the parent is not able to work full-time because they have to remain at home to care for the child, they can be the IHSS provider. Okay. Now, in a two-parent home, one parent has to be working full-time, 40 hours a week, and the other parent has to be precluded from working full-time in order to remain at home to care for the disabled child. Now, sometimes they'll drill down a little bit more on this, and they'll question the parents and say, well, did you actually have to leave your employment to stay home? Or are you not able to do 40 hours a week because you have to stay home? Sometimes the IHSS social workers will drill down on that, but this is the way the parents can be paid. Now, in determining the number of hours and minutes that IHSS authorizes, those county guidelines that I talked about they allow for the fact that there's certain support that parents give to their children. And so the guidelines and the number of points you can get is skewed towards, for instance, a child that's 2 years old, you still may be doing a lot of those things that you would do for an adult who is disabled. But because they're a child and it's a parental responsibility to provide those kinds of care, they don't give you any time for those. So the hours don't really start to kick in until the child is at least 4 or 5 years old, and the child begins to require support and services above that a non-disabled child of the same age would require. So it's many times the parents are saying, well, they're just not giving me any hours, and it's because the child maybe is too young. And so the following year, those guidelines allow for the fact that as the child gets older, then more minutes and hours can be allotted for each of the support categories. That was quick and dirty. We got plenty of time for questions.
Great. We've got a few, so here we go.
Okay.
Okay, so the first one says, I submitted the initial application for IHSS and submitted doctor's form. What do I expect next? I didn't hear back from them. What should I do? Thanks.
Yeah, recon. Yeah, the form I assume that you're talking about is what's called the healthcare certification form. And so you should recontact IHSS. You know, they're like many county organizations, they're probably understaffed and overwhelmed with cases. So you have you've applied, I assume they provided you the form, and you for the doctor to fill out the healthcare certification form. You've presented that. So if they're not contacting you, you should contact them.
Great, thank you. The next one, do IHSS services continue when a client with SSI-based Medi-Cal and IHSS services has a parent who applies for retirement benefits and disabled adult child receives disabled adult child benefit?
Yes,
The child,
yeah, that having those benefits from Social Security does not negate IHSS services.
Okay, and then it continues. Does the adult child IHSS continue under DAC Medi-Cal?
Yes, it can be a disabled adult child Medi-Cal. As long as the individual is on Medi-Cal, then they can apply for IHSS. Yes.
How do we get Medi-Cal?
Good question. For individuals who are under 18, children, minors, the parents' income and resources are counted for Medi-Cal eligibility purposes. Now, it's true that the Medi-Cal asset limit has been raised to $130,000, and next year it's supposed to go away totally. The income requirements and income limits are still in effect. So if it's a child under 18, the parent's income and resources are deemed to the child. In other words, they're counted as if they're the child's income and resources. But there's a trick that we use, and some of you may be aware of it, and it's a process called institutional deeming. And that's if the child is a client of the regional center, and the regional center is paying for at least one service. It's usually respite, or I've even seen regional centers use MedAlert bracelet as the one purchase. And the regional center then places the consumer onto what's called the Medicaid waiver program. It's called the DDS Medicaid waiver. It stands for Department of Developmental Services. And this is where it gets a little tricky. So the regional center has a consumer under 18 providing one service. They place the child onto the Medicaid waiver. And then the regional center asks the local county Medi-Cal agency to institutionally deem this child on the Medi-Cal by only looking at the child's income and resources, not the parents. So that's the way that we can get a child when the parents' income and resources are too high. We can get the child on the Medi-Cal. Once on Medi-Cal, then we can apply for IHSS.
Great, thank you. And the next one is, if a disabled person is living with a parent, is the parent expected to provide those services?
I'm sorry, was it an adult, did you say?
Yeah, it doesn't say if an adult, it just says if a disabled person is living with a parent, is the parent expected to provide those services?
Wh-
I'm assuming.
Well,
Um,
let's do both. So again, for a child, if it's the type of service or support that a parent would give to a non-disabled child, they're not going to get any time for that. But as the child gets older and is disabled and requires more support than a non-disabled child would require, then IHSS hours can be provided. So it's not like a blanket, parents are required to provide all the support up to age 18. It's only that support that the parents would give to a non-disabled child of the same age. Now, once the disabled individual's an adult, it sounds weird, but the parents have no legal responsibility to provide any. I think my thing's going weird.
yeah, it's going a little. But if you want, just cover your, stop your video,
Yeah.
or there you go.
You may do that again. I've been having trouble with my camera. But once the individual is an adult, the parents have no legal responsibility to be providing any support. And so then there's no deduction for the parents being there and no requirement or expectation that they be providing any of these services for free.
Right. The next one says, does the form have to be signed by a physician, or will a nurse practitioner or physician assistant be able to sign off?
You know, I've seen some of those. Well, let me back up. I'm pretty sure it does ask for the doctor's license. So I believe it does need to be a doctor. I'd have to look at the form again.
Okay. The next one, is there a way to live in self-certification retroactively if you did not know about it when you first started providing IHSS as a parent?
Unfortunately, no. Like most government, they won't go retro. You have to have applied because there's the whole process of the doctor certification form and the assessment, and they can't do that retroactively. So no, unfortunately not. The date of the one thing is that the date of application does become the protected date. And so once they do the assessment, the hours that have been authorized will be retroactive to the date of application.
Great. Can you please provide the PS form?
Protective supervision form. You can just Google that. You can just IHSS protective supervision. You should be able to pull that up.
Okay. Sorry, I joined. Yes, we will be sharing the slides again, so I'll make sure to include them here in the chat, and we are going to be including recording within a few weeks. The next one says, if a child has a protective supervision hours, what happens after the child turns into an adult? Can parent continue to be the IHS provider and start working full-time? Can both parents work and continue to get protective supervision?
Yeah, good question. Two questions there, I think. Protective supervision can be for a child or for an adult. And the issue of whether the parents can be the IHSS provider is only when the child is a minor. Once the child is an adult, then there's no question that the parents can be the IHSS providers. And there's no stipulation that one has to be working or that sort of thing.
Okay. My child is 19 with moderate autism. He does not yet have Medi-Cal or SSI. In what order should we apply for these benefits?
You need Medi-Cal first. And given that he's over 18, he can apply for Medi-Cal on his own. Once on Medi-Cal, then he can apply for IHSS.
Great. Can family members, not parents, be IHSS provider for the individual? Can
Yep.
multiple family members serve as IHSS providers after child turns 18?
Actually, the first question, yes. Anybody that the family selects or the individual selects can be the IHSS provider. They have to go through the background check because and this is something I didn't cover in the slides, but the IHSS provider, parents or whoever it is, they have to go through a orientation and background check by the county they become an employee of the county. So they turn in a time card every month and get paid. They are union members. They are employees of the county. And yes, the provider there could be multiple providers, because sometimes there's so many hours that are authorized, it's going to take more than one person. It could be multiple family members. It can be friends or relatives. If you cannot come up with anybody that you want to have as the provider, the county has a list of people, a registry, and you can ask for names from that registry. And you can even request someone that doesn't smoke, or someone that can not allergic to cats, or you can drill down a little bit on the individuals that you would like referred to you, and you can interview them over the phone or whatever, then interview them in person, and then if you want to select them as the IHSS provider.
Great. What is the expected timeline from turning in your application until approval or denial?
Oh, it's hard to say. With each of the counties, they're so overwhelmed. I think it comes down to who gets the case at, if that person is overwhelmed. As far as I know in the regulations, there's no time limit. I've seen it happen quickly, but with COVID, it's really just slowed everything down. So I really can't give a time frame.
Okay, and then we have one in Spanish. I'm going to do it in Spanish and then try to translate it. Hola, ¿cada cuándo el trabajador social hace visitas a la casa para revisión? So how often does the social worker make visits, like revision?
Oh, that's a good question. They're supposed to do it annually. They don't always. But if the individual's care needs change, you can ask for a reassessment at any time. So if their care needs change, then you can recontact IHSS and say, hey, we need to relook at how many hours you've authorized. And so that can be requested at any time, but absent that request, it's done annually.
Great. Can parents be the IHSS provider when the disabled people turn 18? Both parents are working full-time.
Yep, I answered that before.
Okay. If individual is over 18 and doing a day program, can the IHSS hours be used towards supporting the individual for the day program that is outside home?
I was following that until they got to the IHSS hours can't be provided while the person's in the day program. But I think what they're asking is, can that be provided when they come home from the day program? Yes.
Okay. I think it was they were asking, can the IHSS hours be used towards supporting the individual for the day program?
Meanwhile, they're in the day program?
I believe so. That's how I read it.
No, because the day program, that would be what's called an alternate resource, and the day program is providing the support. So no, I've not seen the IHSS workers follow the individuals to the day program.
Okay. Please, I am new in IHSS. My son is 58, I am 80, and my husband 88. What are the requirements for supervision preventive help? He was in a group home before August 2023.
Yeah, if he's at home now, he can qualify, and you can apply for IHSS for him. In fact, he was in a board and care home, doesn't matter, as long as he's living either in your home or his own home now, he qualifies to apply for IHSS.
How to get prior COVID sick hours? They denied me and didn't give me a notice of action after multiple requests. Their accounting department has no response after multiple emails.
What was the first part of the question?
How do I get prior COVID sick hours?
I don't know what prior COVID hours. I don't know what that, I understand that part of it. Is if you're not getting a response from IHSS, you just have to, keep bugging them. I mean, even if you have to go down to the IHSS agency and talk to a supervisor, that's usually the best, is ask for a supervisor.
The other one is in Spanish. I'm going to interpret as well. ¿Cuánto tiempo puede durar recibiendo IHSS una persona? How long can they actually qualify for IHSS services?
As long as they're in need of it. So it can be all the way since they're, 3, 4, 5 years old until they pass away.
Great. Okay, this was just providing us some feedback that the disabled person was an adult, but you gave answer to both questions anyway. So it says, if a child has protective supervision and child turns 18, is the process for the annual review any different? SOC 821 form. Does the individual need any special evaluation, or just the SOC 821 form is good for continuing to be eligible to receive IHSS?
Well, that form, it doesn't automatically result in protective supervision. It's just one of the things that the IHSS worker and their supervisor will consider in whether they're going to approve protective supervision. The form needs to be filled out. The IHSS worker is going to want to see this individual. I've had cases where, the IHSS IHSS worker will say, well, Johnny was able to sit through 2 hours of assessment, and I didn't see any behaviors that he was going to put himself in harm's way of endangering himself. So no, the form is not automatically a ticket to get protective supervision.
Okay. The next one, when my child turns 18, does my child continue to have IHSS under my care?
Yep, IHSS can be of any age.
Okay. My adult son lives with me. How do the IHSS hours paid affect his continued qualification for SSI and Medi-Cal?
It does not affect either.
Okay. How does Medi-Cal recover the IHSS money spent on IHSS recipient after they pass away?
Well, if the individual has a special needs trust, maybe this gets down the weeds a little bit, but if they have a first party special needs trust that allows for Medi-Cal to be paid back, then IHSS may well be able to recover from the special needs trust. And so there can be a clawback from Medi-Cal for what's been provided through IHSS, yes.
Okay. For a child with IHSS services as a minor, can you explain the process for continuing to be eligible to receive IHSS services at similar levels?
Not sure. From becoming a child to an adult?
Yeah, just as for a child with IHSS services as minor.
I'm not sure I understand the question.
Yeah, maybe if you can just elaborate a little bit more, we would really appreciate that. I'll leave the question open here.
Okay.
The next one is, if a disabled child turns 19 and gets SSDI benefits, does that count as income? What if that is over the income limit? Can the regional center help with a DDS type waiver?
The waivers are only for minors. The waivers are the DDS Medicaid waiver that I talked about that allows for institutional deeming is only for minors because it excludes the parent's income and resources. Once the individual is over 18, 19, such as in the question, then their income and resources are counted, and there's no way to avoid that by the regional center putting them on a waiver or whatever. It does not preclude that individual's income and resources being counted. They've got to be eligible for Medi-Cal to get the IHSS.
Okay. Next one says, my daughter is 18, getting evaluated by a RC, but not yet getting services. I just got a limited conservatorship for her, and her federal disability application is pending. Other than applying for Medi-Cal, what am I missing?
Well, I have to do a whole benefits assessment. It's, you could read it again if you would.
Sure. My daughter is 18, getting evaluated by, I'm assuming regional center, but not yet getting services. I just got a limited conservatorship for her, and her federal disability application is pending. Other than applying for Medi-Cal, what am I missing?
Well, SSI, possibly Social Security disability, childhood disability benefits. maybe still special ed. It's hard for me to do a benefits assessment not knowing. That's the sort of thing I do for families is benefits assessments. But given what you've given me, I can't really give you a complete answer.
Okay, the next one says, once child turns 18, can parents split the hours to support IHSS, both working full-time, to receive the protective supervision form?
Yes, except the last part, to accept the protective supervision form. I don't understand that. If the question was, can the parents can split the hours once the child's over 18, yes.
Okay, once the parent applies for retirement benefits and the child gets portion of benefits, does SSI Medi-Cal automatically change to a DAC Medi-Cal, or do we need to apply for DAC Medi-Cal and IHSS again?
If they're on, you don't have to apply for IHSS again. If their type of Medi-Cal that they're on changes, it doesn't matter because there's so many different ways to be on Medi-Cal. So if they're on Medi-Cal and they have IHSS and they change to a different kind of Medi-Cal, it doesn't affect IHSS.
Okay. The next one here, what documents do I need to prepare for the home evaluation? For example, I can write down the hours and services that provided for the disabled people per week.
That's a very good question, and I would refer people to Disability Rights California. They have on their website, they have a number of worksheets. They have just lots of good information on how to prepare for the IHSS assessment. And that includes keeping a log and knowing all the various categories that you're going to want to present to the IHSS social workers so that you can get as many hours as you can. But Disability Rights California is a great resource.
Okay, now if the parent is the IHS provider, does that mean that the parent is getting paid?
Exactly. They're getting paid to care for their own child, which sounds weird, but they're providing services above and beyond what a non-disabled child of the same age would be requiring. And then, of course, once they're over 18, again, there's no legal responsibility for parents to provide any support to the disabled child. So they're being paid to provide all that support.
And then we have another one in Spanish. Let me read it first. Un padre que vive con el niño con discapacidad y recibo IHSS debe pagar impuestos por el dinero recibido. So this is a parent that lives with the child and receives IHSS. Is this tax-free? The income?
I'm not a tax person, sorry.
Okay. The next one, if I am the provider, what happens when I need respite care?
Well, respite and IHSS are two different things, although I did make a note to myself, I wanted to talk about this. When you go to apply for respite from the regional centers, they will many times say, well, are you getting IHSS? And you wonder, well, why are they asking that? The reason they're asking that is if your child or adult is getting IHSS and you are not the parents are not the provider, then the regional center considers those hours to be time when you could be out and it would be the same as respite. So many times the regional center will count that against how many hours of IHSS, how many hours of respite they're going to give you. However, what I always tell families is if they're the provider, the IHSS provider, then it's not respite to them. And so that should not affect how much respite the regional center authorizes.
Great. Does the educational qualification, diploma, or certificate of completion affect the hours the child receives?
The education what?
If either the student gets a diploma or a certificate of completion.
No, that's not taken into consideration for how many hours of IHSS are authorized.
Okay.
It's all you know, what the needs, what the support needs are of the individual.
Yeah. Is the IHSS pay minimum wage?
Yes, in each of the, well, it's more than minimum wage. As I said, it's unionized. So in all 58 counties, the union negotiates with the local county boards of supervisors as to what the hourly wage will be in that county for the IHSS workers, and it differs from county to county. You can Google that, and you can find how much each of the counties are paying their IHSS providers, and it is above minimum wage.
Will asking for protective supervision prevent a person from working in the future? Will the potential employer be able to see the disabled medical records?
No, they can't because of HIPAA laws. They can't. The future employers will have no access to the information that this individual had IHSS.
Can I work full-time and still work as an IHS provider for my son who is 18?
Yes.
If the child needs more hours of support in 1 month than another month, can the hours be straddled across the month?
That I don't get involved with the actual hours. That's a payroll question. And when you are selected as being the IHSS provider, you go through an orientation that explains to you how you fill out your time card. I don't think you can, I don't know for sure the answer to that.
Great, thanks. I tried applying for Medi-Cal for my adult son through the county, but they told me to apply for SSI because the SSI process will include Medi-Cal.
That's true. The SSI process will include Medi-Cal. That is one way to get Medi-Cal. There's so many different ways. So yes, if the person gets SSI, they get Medi-Cal, and that Medi-Cal is without a share of cost.
Okay, how does an adult child receiving SSI, SSDI, Medi-Cal, and other country RC or DOR services affect the IHSS hours or services?
Well, getting any of those benefits would not affect, list them again, which benefits?
SSI, SSDI, Medi-Cal, Regional Center, DOR.
No, none of those, unless the regional center is somehow providing service, but they don't do care. Regional center doesn't pay for care hours. So I don't think any of those things would negatively affect the number of IHSS hours.
Okay, this one says, I applied on 2/4 and turned in the DR form SOC 873 later. Will I get paid back on the application date?
My understanding is yes. Well, let me qualify that. The payments will be effective, I believe, it's either as of the date of application or as of the date that the assessment is made. It'll be one or the other.
Okay, if parents need to travel out of the country due to family emergency to take care of grandparents for a few months, can we continue to claim IHSS while abroad? Child is also traveling with parents overseas.
No, it's supposed to be done in your home.
Okay. If my daughter gets Medi-Cal, will that become her prairie insurance even though I have her on my insurance and it is better?
Medi-Cal is always secondary to private health insurance. But even though it's secondary to private health insurance, because she's on Medi-Cal, she can apply for IHSS.
Will the caseworker change if we move out of county?
Oh, yeah. Yeah. Each of the counties run their own IHSS, and it's not automatic that the same number of hours that you get in one county, you're going to get in another county. Each county can do their own assessment.
Okay. Can I turn in Form 873 and 821 before the first assessment?
I'm forgetting which numbers those are.
If you can clarify, maybe, parent, we would appreciate that. We can get back to it. Does a check from IHSS expire?
You'd have to talk to the payroll department at IHSS. They must be sitting on an old check.
Yeah. Could you elaborate on how special needs trust can be affected by IHSS? Are there additional resources you can provide on the topic?
Having the special needs trust does not affect the IHSS. What I was saying was, I'm sorry, having the special needs, if it's a first party special needs trust, then there's the possibility of Medi-Cal payback. And so whether or not IHSS may have a claim to be paid back upon the passing of the individual if they have a first party special needs trust.
Okay, then this one's in Spanish. ¿A qué edad uno puede como mamá aplicar por nuestros hijos? Tengo uno de 11 con autismo, ADHD y ODD, y mi hija tiene 16 y tiene ADHD. So what age can she apply for these services? She has an 11-year-old with autism, ADHD, and ODD, and her 16-year-old who has ADHD.
Certainly 11 and 16, yes, that's age. I've seen some counties that without justification and without support from the regulations say that they won't take an application for IHSS unless the child is 5. But there's nothing in the regulations that stipulate the age. Again, what it comes down to is because of the disabilities, are the care needs greater for the child at age 3 or 4 or whatever than for a non-disabled child? That's what it comes down to. Now, you may not get many hours at that point, and as the child gets older, you get more and more hours because those supports wouldn't usually be provided to a non-disabled child of that age.
Great. If my daughter gets SSDI, will she automatically be qualified for Medi-Cal?
No, SSDI carries with it, I assume what they're talking about is Social Security Disability Insurance, Childhood Disability Benefits, which is off of a parent's Social Security account. You after 24 months, you get Medicare, you don't get Medi-Cal. And so, and even if it's SSDI off of the individual's own Social Security account, again, you get Medicare, you don't get Medi-Cal. With SSI, you get Medi-Cal.
This is a long one, but it says, do parents as parent providers have to have conservatorship to continue to claim or submit timesheets after child turns 18? First
No.
question.
No.
Okay. Is the process for submitting timesheets online same as before they were 18?
I don't know. I don't do timesheets.
Okay, and in other words, can parents without conservatorship continue to sign and claim IHSS hours?
Well, if they're the IHSS provider, yes.
Okay, being a single parent, does that mean you can do the 283 hours for an adult of 20 years old?
Yes.
Okay, if both parents are providers and splitting the support hours and working full-time after the child turns 18, will the IHSS payments be made to parents or to the adult child?
Oh, good question. Yeah, the IHSS parents are never, I'm sorry, the IHSS payments are never made to the individual. They're made to the providers. As I say, the provider, whether it's parents or someone else, they become an employee of the county and it's a regular paycheck. Taxes are taken out of it, you know, the whole, just like any employee, they're on payroll, so they have deductions from their paycheck.
And I think you already answered this part, but it says, will these payments be considered as income for an adult child or be considered as income of parents? Obviously, parents.
Well, it wouldn't be income for the child, but talk to your tax person about, is it income for you?
Yeah. Should parents apply for SSI first or Medi-Cal?
Well, you need to get them on Medi-Cal, and you can either do that by getting them on SSI, because then he'll have Medi-Cal, or you can apply for Medi-Cal through the county. But you need to have Medi-Cal before you apply for IHSS.
Okay, then this one, my adult daughter was denied PS because she knows her name, phone number, address, and the president of the US. She is 35 and has had numerous years to learn this. She is impulsive, would open the door to strangers. She still, after all these years, doesn't remember to look both ways to cross the street or pay attention to what's happening around her as far as being aware of dangers. What else can be done? Have appealed and then denied.
Well, that's what I was going to say. You can appeal, and you have to present to an administrative law judge why the IHSS social worker made a mistake. And you have to give good examples to the judge, such as you just did in your question. And then the judge decides whether or not, due to memory, orientation, or judgment, your child is in danger of harming themselves without the full 283 hours of protective supervision. But there's all you can do is appeal it, and it sounds like you've done that. Now, I've seen where the IHSS social worker changes for the next year's assessment, and they'll approve it. So you never know. It could be that you wait until you have a new IHSS provider, and maybe they'll approve it.
Great. Before we go on, since we do have a few more minutes, I just wanted to mention that we included the links for the Google Docs to fill out the evaluation in both English and Spanish through the chat. So if you could please take some time, we would really appreciate it. And then I'll answer a few more. We can go on. We have just a few minutes. So this one was actually similar to one that you answered, is that if from in Spanish, when they go out on vacation, they cannot request those hours to be paid. Mhm. Do IHSS parent providers have the mandatory, have to mandatorily join the union?
Yes. My understanding is that all 58 counties are unionized, so you have to join the union.
Okay. My daughter is level 1 high functioning ASD until she gets overwhelmed and totally shuts down. She interviews well, then collapses later. How do we prove we need services?
Well, just collapsing later doesn't qualify you for any minutes or hours. You have to break it down into exactly, do you have to bathe her? Do you have to toilet her? Do you have to cook a meal for her? All those things. You have to go category by category, and the IHSS workers should listen to what you're telling them as to the areas of support that she needs.
This parent in Spanish, if I move to another county, do I have to request services again?
Yeah, there's supposed to be a process by which it's transferred. It doesn't always work, but what you should do is inform the county you currently live in, the IHSS agency, and then when you get to the new county, inform them, and there should be a process by which the IHSS can be transferred. But what I have found is that the new county's going to do a new reassessment anyway.
Will the per hour amount change when you move out of the county?
If that new county has a higher hourly rate, yeah, it would change.
Can one parent receive hours for 2 eligible children?
Should be able to, yeah.
Is IHSS services state specific? If family moves out of state, can IHSS continue?
Well, this is a California program, so other states may have something similar, but it may not be called IHSS. It might be done through a waiver or God knows how, but it might. So no, it's not exactly the same in every state.
And then they ask, can you repeat the name of the organization who has information to prepare for the evaluation?
Disability Rights California.
Right. Does the individual need to live with parents or in parents' home to continue to receive IHSS support? After they become an adult, if they move out to live in a home, can parents continue to offer IHSS care at the place where the child lives?
Good question. And the answer is yes.
Great. Since I have the conservatorship, I assume that means I can complete the Medi-Cal application. However, do I need to pursue Medi-Cal since her SSA disability application is pending, assuming it gets approved, of course?
When they say SSA application, I'm assuming they mean SSI application.
Is it SSA disability application?
Yeah, and what was the first part of the question?
Since I have the conservatorship, I assume that means I can complete the Medi-Cal application. Do I need to pursue Medi-Cal since her SSA disability application is pending?
Well, if you get, again, I assume they mean SSI. And again, if the SSI is approved, then they'll be on Medi-Cal. So you won't have to do a separate application. If they don't get SSI, then you would have to do the application through the local county Medi-Cal agency.
Okay. If a military family moves out of state or overseas for military duties, does IHSS and service member is still a California resident?
Well, it has to be provided here in California. So I would say no. If the family's moved out of state, I'd say no.
And then question, I'm guessing difference between SSI and SSDI.
They're asking what the difference is?
SSI versus SSDI.
Yeah, big difference. SSI is supplemental security income. That's a means tested benefit. The individual cannot have more than $2,000 and has to have limited income. If they're under 18, the parent's income and resources are deemed to them. They have to be disabled. And they in California, for Social Security, being disabled means the incapability of grossing $1,470 a month. SSDI is not means tested. The person can have all the money in the world. They can have income as long as it's not earned income, and that they either would get that benefit if they've worked, they would get it off of their own Social Security account, or they would pull it off of their parents' Social Security account, but the parent must be on Social Security, retirement, or disability. And the amount that the adult child would receive would be equal to 50% of what the parent's receiving in Social Security, retirement, or disability. And then when the parent passes away, the benefit amount would go up to 75%. That's a quick analysis of those two benefits.
Awesome, thank you. It says my case coordinator has assigned a person to verify I submit hours because I don't have a conservatory.
Are they talking about the regional center worker? I don't.
It doesn't say, so if maybe they can specify. We have some time here. Then can I apply IHSS while my son Medi-Cal application is pending?
No, you gotta be on Medi-Cal. That's the first thing when you contact IHSS. The first thing they're gonna ask is the name. They're gonna look in the computer, see if that person has Medi-Cal. If they don't have Medi-Cal, they can't apply for IHSS.
Okay, then this one, it says IHSS offers Medi-Cal dental vision services for parent provider, but does not allow adding another parent to be added in the Medi-Cal dental vision plan. Is there any plan to let other parent also be added to the plan? Child is over 18 and the second parent lost the job and has no insurance coverage through the former work.
Yeah, I assume what they're talking about is that some of the counties do provide health benefits to the IHSS providers. And so that's outside my area of expertise as to whether or not they would allow the other parent to join that health plan.
Great. And then this one, union question. I'm a parent provider and I'm not in a union. Union is mandatory. I don't see any benefits for the union other than taking your money.
Well, that's the feeling a lot of people have, but my understanding is that all 58 counties are unionized, therefore you got to join the union.
We still have a few here, but I think I can say one or two more. Can you please clarify if conservatorship is a mandatory requirement to continue to receive IHSS services after they turn 18?
No, it's not required.
Okay. And if a child has Medi-Cal, why would they need SSDI? Does SSDI offer any other insurance other than Medi-Cal insurance?
That's a very good question. SSDI after 24 months gives you Medicare. And Medicare is a much better benefit than Medi-Cal.
Great. The IHSS supervisor assigns someone to verify I submit my hours. Oh no, this one I already mentioned. And then this last one here that I'm going to mention. For a child who is 20 years old with established needs and received IHSS services for more than 10 years, will there be annual review or review is done once every 2 years?
Well, it's supposed to be done every year, but given COVID and the lack of staffing, it's not always being done, but it's supposed to be an annual review. Now, sometimes those reviews are like a phone call, that they'll call and they'll say, well, has anything changed in the care needs of this individual? And that could be the whole extent of the review.
Awesome. Well, thank you so much, Jim. This was
Sure.
like, wow, question galore here and answer. You did amazing. We appreciate, we had like over 80 questions here.
That's
and
great.
You answered most of them. So thank you so much. We appreciate your participation.